good evening. Thank you for coming. To start off the evening, let's just kind of toss around a question or kind of an idea. There are 15 states in the U.S. that are doing something that Texas is not. Can any of you guess maybe what that might be? No? Well, actually, 15 other states are currently allowing the use of marijuana for the sake of medicinal purpose. Now, all of us, I'm sure, know what marijuana is or at least heard of it at some point in our life. However, not all of us have necessarily heard about what kind of potential marijuana has as far as the medical field is concerned. So let's kind of start out. What exactly is medical marijuana? We've heard that term used, tossed around in the news, kind of as a controversial topic. So what exactly is it? Marijuana and the term cannabis are essentially synonymous. They're used interchangeably. Cannabis is the biological name of the actual plant that marijuana is grown, the flower that you see. So the use of cannabis and its constituents, cannabinoids, which are essentially the chemicals that marijuana releases, such as THC, the hallucinogen that we've sometimes heard of that comes with marijuana, as a physician-recommended form of medicine. So these are some of the beneficial uses for medicinal marijuana include things such as AIDS, Alzheimer's disease, arthritis, asthma, Crohn's, glaucoma, and even to treat migraines. So obviously these are some more severe symptoms and severe diseases. However, there have been many cases where marijuana used for medicinal purposes has actually helped, even more so than some of the drugs that we've been prescribed in the past. In fact, Jocelyn Elders, a U.S. general surgeon, says, "The evidence is overwhelming that marijuana can relieve certain types of pain, nausea, vomiting, and other symptoms caused by such illnesses as multiple sclerosis, cancer, and AIDS, or even by the harsh drugs sometimes used to treat them." So this is saying that some of these severe diseases and symptoms sometimes are even better treated by the use of marijuana, but even more so, sometimes the medicine that we're given to treat these diseases, marijuana is used to treat those symptoms as well. Someone that we might know more commonly, Ron Paul, politician, he talks about, he's very much for marijuana use for medicinal purposes. He's a little bit perplexed with the FDA because the FDA has passed a lot of drugs that have tried to help cure some of these side effects and things of these severe diseases. However, they've oftentimes been way more dangerous than marijuana has ever been. So he says, "It perplexes us that even the FDA is responsible for protecting public health. This agency has failed to respond adequately to the Institute of Medicine's findings 7 years after the study's publication date." The Institute of Medicine did a huge study over marijuana for medicinal purposes and found that the results of the use of marijuana was much better than any of these common drugs that have been prescribed and much more healthy. So he does kind of have a point in my opinion. However, one specific disease that has a lot of attention with the use of medicinal marijuana is cancer. And not just any specific type of cancer, but majority of cancers, lung cancers, breast cancers, melanoma, a lot of times marijuana is used not to cure cancer. However, there have been studies that have talked about that as well, but mainly to help with the symptoms of chemo and radiation that come with cancer. A lot of times people won't consider chemotherapy or radiation because of such severe symptoms that they cause, such as extreme nausea, even depression, lack of appetite, just general overall unhappiness with how they're feeling. However, they found that with the use of marijuana, they have really helped with these symptoms and have made people more reasonable with trying to use chemotherapy and radiation to help cure the cancer, because even though the marijuana isn't directly curing the cancer, the chemo is. However, the marijuana is helping with the side effects that the chemo is causing. So a lot of times, cancer patients overall are much happier with the outcome with the use of marijuana. Unfortunately, however, when patients aren't using marijuana to help with the side effects, they're oftentimes left with just these miserable feelings. However, with the use, increased appetite, reduction of pain, vomiting, nausea, as well as an increase in overall happiness has happened. However, over 20 major studies in the past 9 years have shown that cannabinoids, the chemicals that I had told you about earlier, actually fight off cancer cells. So this is something that hasn't had a whole lot of research because, like I said before, it wasn't intended to actually cure cancer. But with these kind of results, this might be the cure for cancer that we've been looking for many, many years. However, without legalizing it and without further having more money to research and without having these opportunities, we won't really know. But it has been shown to potentially be causing cancerous cells to turn into cancer-fighting cells, which is a huge medical breakthrough if this is actually the case. Also, in addition to cancer, marijuana has also been proven useful for treatment of arthritis. Many people take aspirin, Tylenol, Advil, other kind of medications to help with arthritis. However, aspirin alone has concluded to about 1,000 deaths annually in the United States. Things such as Advil, Tylenol have concluded to 70,000 hospitalizations. These are things that are extreme. I mean, these are just over-the-counter drugs that you can buy to just help with aches and pains. However, marijuana smoked several times a day is often as effective as these and hasn't been proven a single death. So this is something that is an extreme breakthrough. I mean, something that's causing the same kind of outcomes as these other drugs, that's causing deaths and hospitalizations, can be cured with something just with as simple as using marijuana. There are a couple of different ways it can be administered. Obviously, a lot of us know you can just smoke it. However, there have been a lot of positive reinforcements with turning it into a vapor. They've noticed that a lot of times people with cancer and stuff who are suffering with the nausea don't necessarily want to smoke something that doesn't really help with the symptoms they're already feeling, but if they can just simply breathe in a vapor, or even put it in something that they're eating or something that they're drinking through like an oil or some type of butter, put it in food, and drink it, eat it, that helps a lot too. So these are just different ways that it can be used. It does not necessarily have to be smoked. It can be something just as easily done as vaporizing. However, the FDA has used something, they have tried to approve something that uses THC, a component found in marijuana, to help with the symptoms of chemotherapy, called Marinol. However, this has not been proven nearly as effective as the actual use of marijuana itself. So that's something to be considered, that why would we spend all this extra money producing something that the FDA is moderately okay with that isn't even as effective as marijuana itself? All of this, needless to say, marijuana is certainly something that should be considered, should be researched more heavily, and should definitely be something that is not so frowned upon, because it does not have to be used in its negative way. It can be used for extreme medicinal purposes, as you've seen so far. So with that, are there any questions that I can answer?
I have a question.
Yes.
Do you know of any specific cases where marijuana or medicinal marijuana has been used to actually fight cancer?
Yes, there have been stories of people where, like I said before, it has been used to fight cancer and it has actually been used to cure cancer. There's actually been a case where they studied it with cervical cancer. They treated a patient with marijuana. She inhaled it through vapors for a certain amount of time, and they actually found that the cells that she was used, like that were cancerous cells, 68% of them turned to non-cancerous cells. Okay. So that study wasn't fully researched, but that is an example of it. However, there has been a story. Her name is Shauna Banda. She's actually the author of Live Free or Die. She suffered with Crohn's disease, and she actually underwent 15 surgeries to try and remove parts of her colon when the Crohn's would flare up, and none of that would working. I mean, about half the time it would kind of suppress itself, but then the Crohn's would just flare back up again with diet choices, blah, blah, blah. So after using marijuana for medicinal purposes, she was actually cured completely free of Crohn's. No more surgeries, none of that. She's still free. She talks about that in her book. That's one of her main points in her book, is that she had been trying all these other things that the doctors have been saying, but, you know, had maybe marijuana been legalized where she was for medicinal purposes, she might have not had to have any of the surgeries. She might have been able to just use that. Okay. Any other questions? No? Hey, thank you for your time. I hope you enjoyed.